Testing for women is very different than testing for men. The overall prevalence and incidence of heart disease in women at any given age is much less than it is for a man. So the false positive nature of our test is a lot higher. At this point, general exercise stress testing has a high false positive rate, and doing further, better diagnostic testing with higher sensitivity and accuracy is probably much better suited for our patients. Stress echoes, stress nuclear tests are generally higher recommended in women than they are in men. That being said, the procedures that we do on women, unfortunately, probably have a higher complication rate. And they do because at the time of presentation, women seem to have other more comorbid conditions that become important. Women are generally about 10 years older at the time of presentation than men are, which means that there's more renal failure, there's more hypertension, there's more diabetes, and there's other conditions that increase the general morbidity and mortality of patients having procedures. Cardiac catheterization procedures, stent procedures, bypass surgery, all of these very important things that we do here at the medical center and here at the heart hospital have higher morbidity and mortality for women than for men. This has nothing to do with them being a woman, and it's not a gender problem, but it has more to do with them being older at the time of presentation and having much more comorbidities at the time of their presentation. We still treat them with similar types of procedures. We still offer stent procedures. We still do bypass surgery. And even though that the risk may be a little bit higher, the risk-benefit ratio is much higher for women. So these procedures become very important in their long-term outcome in terms of heart disease complications.